welcome to the Nurse Preceptor channel on YouTube. I'm Hillary, your Nurse Preceptor, and today we are going to be doing a first aid tutorial on how to apply Steri-Strips or wound closure strips. My channel's mission is to provide high quality instruction on nursing and medical issues so that you are more empowered to make smart decisions for your family, yourself, and people within your sphere of influence. And my secondary mission is to improve your confidence in your own abilities to provide basic nursing and medical care when it's needed. So Steri-Strips is the brand name, but I have the off-brand version of the wound closure strips. I got them from Walgreens. You can get them at retail drugstores in the wound care section. I recommend having these as part of your medical kit at home. Steri-Strips are strong adhesive strips that can be used to hold together the edges of a cut, and they work like sutures, but they're applied topically instead of sewn into the skin, so you can do them yourself, which is great. They're best used on cuts where the edges are fairly straight and the skin can be pulled together easily. I have a skin model. If we had a cut like this that's a pretty straight line, the edges can be pulled together really easily. It's likely to give you a very good cosmetic result in the end, and that's part of the point of using these, is so that it decreases scarring and helps the wound to heal more effectively. Wouldn't recommend using these on facial wounds due to the risk of scarring if you don't apply them properly, so seek medical attention if you have a serious facial wound. So use these on fresh wounds with a low risk of contamination and wounds that are relatively minor. For example, if you cut your arm with a box cutter, if you cut your hand with a clean knife, something that you can irrigate with water or saline. So your first step is always going to be to irrigate your wound. Make sure that you visually inspect it for any foreign bodies or debris. And if you see any foreign bodies or debris that's stuck in there, either use tweezers to pull it out or continue to irrigate it until it flushes out. Apply direct pressure with gauze to stop bleeding. And I recommend using non-stick gauze like Telfa because it won't stick to the wound as the blood starts to coagulate. Please make sure your skin around the edge of the wound is dry before you try to put the Steri-Strips on, because they're not going to stick to wet skin. These Steri-Strips come in really long strips, and what I like to do is cut them in half. That way you have essentially twice as many Steri-Strips to work with, and they don't have to overlap the wound by a tremendous amount. The way that I do these is I peel the backing from the strip, I pull the wound together and start in the very center. And you just press down on either side, get the adhesive to stick really well. Continue down the wound. The box says to apply them approximately every 1/8 inch. Obviously, if you have a cut, you're not going to be taking the time to measure that out. So leave about the same amount of space as the width of a Steri-Strip between each of them. And that's a good way to estimate. And I would continue to add them all the way down to the very end of the wound. Once you have your wound approximated with these Steri-Strips, make sure your edges are down really snug. I cover up wounds that have things like this on them. So I would use, again, like some non-stick Telfa type dressing and then tack it down with a little bit of medical tape. And then you're good to go, and it gives your wound a little bit more protection. As far as removing these, they will remove themselves in about 7 days or so. They start to peel off around the edges, and then eventually they just don't want to stick anymore. And by then they're ready to come off. You can always redress your wound with just some gauze at that point. The only thing you really need to do when you have these on a wound is to do a daily inspection of your site. And you're looking for any purulent drainage, so that would be like pus, a smelly drainage that looks greenish, doesn't look healthy. You're going to be looking for redness, swelling, worsening pain, and again, a bad smell coming from the wound, because those are all signs of infection. Keep in mind that some swelling, redness, and watery drainage and some pain will be expected, but they should decrease by the 3rd day. If you notice that it's getting worse or that it persists beyond about the 3rd day, you want to go ahead and have a medical professional evaluate and make sure that there isn't an infection going on. For deep wounds, wounds that appear contaminated with debris, wounds that won't stop bleeding with direct pressure, wounds that worsen, or wounds that are more than 4 hours old, seek appropriate medical treatment at an emergency room or an urgent care facility. Okay, and again, this channel is not intended as a substitute for medical attention, but rather a tutorial on how to handle minor problems on your own at home. All right, so like, share, subscribe, hit the bell if you'd like notifications when I post new content. I have a lot more content that I'm going to be putting out really soon, and would love to share this information with you. All right, I will see you later.